My name is Sharon Hester, and my practicum was focused on food insecurity and diabetes among Native Americans. I wanted to share with you how they became the population with the highest prevalence of diabetes and how working together with government agencies is allowing them to be connected back to traditional foods in order to improve their health outcomes. Before 1940, diabetes was rare among this population. This was around the same time that rations were introduced. Next slide. Commodity answered to preventing starvation, but it did not promote adequate nutrition. This is the beginning of Native Americans' health problems with the disruption of their food system. Government policies can share some of the blame for poverty and food insecurity among Native American communities due to their forced removal. COVID-19 has recently further exacerbated food insecurity and has caused lasting effects. Next slide. For over 20 years, food insecurity has been assessed and monitored by the USDA at a federal level. Although levels of food insecurity rise and fall during certain periods, it continues to persist, and this is disproportionate among people of color. This is intersectionality of race and ethnicity, as well as social determinants. Some evidence suggests that higher risk of food insecurity is among people of color, and it continues even when those social and economic factors are removed. Racism. Research in the health sciences, especially public health, reflect that discrimination and structural racism are key contributors to inequity in health behaviors and outcomes. Racial discrimination includes two components: differential treatment on the basis of race that disadvantages a racial group. Two, treatment on the basis of inadequately justified factors other than race that disadvantages a group. Structural racism refers to the totality of ways which societies foster racial discrimination, reinforcing inequitable systems. For example, housing, employment, earnings, benefits, health care, and criminal justice. Structural racism acknowledges the influence of historic and contemporary policies and practices that are rooted within systems. Structural racism is critical in the fight for equity in food security to improve related outcomes in people of color. Next slide. Government policies largely impact food insecurity. One in particular is the U.S. Farm Bill, which modifies standing legislation across the full range of policy areas that it governs. It may vary depending on policy concerns at that time. In some cases, particularly for commodity, conservation, and rural development programs, the new Farm Bill extend, revise, and replace language in laws regulating areas that overlap. Farm Bill authorities, including food and nutrition, food safety, trade, credit, research and extension, forestry, organic production, pesticides, and crop insurance. Next slide. In 2010, the USDA and the Department of Justice reached a landmark agreement with Native American farmers and ranchers to settle alleged incidents of discrimination by the USDA. In addition, the monetary terms of the settlement agreement to create a federal advisory council for Native American farmers was made to address farm program issues, enhance technical assistance to ensure easier access, and the USDA adopted an active tribal consultation plan. These represent an example of the government providing equitable service. Next slide. COVID-19 pandemic further strained Native American communities' fight with food insecurity. SNAP, the Food Distribution Program on Indian Reservations, FDIR, free lunch, and WIC were not enough to sustain sudden job loss, shutdown of programs, and empty grocery stores. The pandemic further highlighted the importance of food sovereignty projects. Native people have been working to utilize federal programs and grassroots programs devoted to traditional foods. The third bill of the CARES Act designated $100 million for FDPIR for additional food purchase and facility improvements. The Native Farm Bill Coalition is lobbying for the ability for tribes to exercise self-governance authority, including around the sources of food, and to improve responsibilities or responsiveness to crisis. Native communities, elders, and youth have been heavily impacted by the COVID-19 pandemic. Next slide. Public health interventions are most effective when communities integrate their own cultures and history into their local programs. The intervention is being created for has to be included in the research so that the findings suggest what steps are appropriate to do what work best or adequately helps the population that the intervention is being created for, and also that the population can be added to or included in the data. Tribes need the ability to exercise self-governance, and efforts should be furthered that support the food sovereignty movement among AI and AIN indigenous populations globally. This provides ways to address public health issues, including chronic diseases, especially diseases like type 2 diabetes and obesity. Next slide. The U.S. Department of Agriculture announced in November of 2022 that new resources and agreement of USDA Indigenous Food Sovereignty Initiative that promotes traditional foodways, Indian country, food, and agricultural markets, and indigenous health through food tailored to AIN dietary needs. The USDA is partnering with tribal serving organizations on these projects to reimagine federal food and agriculture programs from an indigenous perspective, and to inform future USDA programs and policies. It should be noted that award-winning Chef Sherman is a part of this partnership. Chef Sean was recognized in Time Magazine's 2023 as most influential. The goal of this project is to transform America's food systems, focusing on ensuring access to healthy food in all communities. This concludes our presentation on Taste the Healing and some of the background as to why this project was created. This was a simple, short-term change of behavior project to help to increase access to or use of fruits and vegetables in the diet daily, and to also increase physical activity. And just by doing those two things, it can help to lower or to prevent the risk of type 2 diabetes and other diet-related diseases that are preventable. I want to say thank you for taking the time out to listen to our presentation, and I hope that the information that you were given provides you with tools and resources that you can help someone who may be experiencing food insecurity. Enjoy the rest of your day, and once again, thank you for tuning in.